Why are vaccines important? Some things that affect our health are outside of our control. However, we do have the power to change some things that put us at risk for getting sick. This includes vaccinations, sometimes called shots, that help protect us from certain illnesses. Vaccines are the best way to protect ourselves and our loved ones from certain diseases or serious illness. Why are vaccines important for older adults? Adults 65 years old or older. Older adults are at higher risk from getting seriously sick from diseases because of their age. Older adults are also at risk for different diseases as an adult, so you need vaccinations for those diseases. You likely had some vaccines for many diseases when you were a child. However, the protection from those vaccines can wear off over time. Older adults need to keep their vaccinations up to date. What vaccines do I need? In the United States, there is a federal agency called the Centers for Disease Control and Prevention. It is called the CDC for short. The CDC works to protect people's health. CDC recommends that all older adults get vaccines for different illnesses. COVID-19 vaccine. The COVID-19 vaccine is the best protection against COVID-19. COVID-19 is the disease caused by a highly infectious virus called SARS-CoV-2. Adults 65 and older who have no immune problems should get 2 doses of the 2024-2025 COVID-19 vaccine, Pfizer, BioNTech, Moderna, or Novavax. If you have never had a COVID-19 vaccine before and you choose Novavax, you will also need to get a 3rd dose of the COVID-19 vaccines. People who are immunocompromised may require additional vaccine shots and should ask their healthcare professional for guidance. Flu vaccines. The flu vaccine can protect you from influenza, or the flu, which is a contagious respiratory illness caused by a virus that infects the nose, throat, and sometimes the lungs. It's best to get your shot each fall before flu season begins. Pneumococcal vaccine. The pneumococcal vaccine can protect you against pneumonia, a lung infection with a high rate of sickness and death in older adults. All people aged 50 or older should get the pneumococcal vaccine. Shingles vaccine. The shingles vaccine, Shingrix, can protect you from getting shingles. Shingles is a viral disease of nerves and skin that causes a blistering rash and pain in the area of the rash. It is also known as herpes zoster. All people aged 50 or older should get 2 doses of Shingrix. RSV vaccine. The RSV vaccine can protect you against RSV, a virus that causes infections of the lungs and breathing passages. Adults 75 years and older should receive the RSV vaccine. Adults 60 to 74 years old who are at increased risk for severe RSV should also receive the vaccine. Your healthcare professional will consider your risk factors for getting seriously sick from RSV when helping you decide whether to get the vaccine. Tetanus diphtheria vaccine. The tetanus diphtheria vaccine protects against 2 deadly infections that can lead to death. It is recommended that you get this shot every 10 years. There are other vaccines that the CDC may recommend for some older adults. These may be recommended because of the increased risk of getting certain diseases because of certain health problems, occupations, lifestyles, or when traveling to certain countries. Vaccinations for these diseases include the measles, mumps, rubella, MMR vaccine, and shots for varicella, hepatitis A and B, and meningococcal disease. Ask your healthcare provider if they recommend any additional vaccinations for you. Are vaccines safe? Vaccines are safe and effective. It is much safer to get a vaccine than to get the disease. Serious side effects from vaccines are extremely rare. Common side effects are mild and go away quickly on their own. These side effects are a sign that your immune system is responding to the vaccine the way it should. How can I get vaccinated? Talk to your primary care clinician about what vaccinations you need. They can give the vaccines you need or help you find out where you can get them. Your primary care clinician is a doctor, physician assistant, nurse practitioner, or certified nurse specialist who you visit when you are sick or for your overall care. You can also call your local pharmacy to get more information about these vaccines. Many pharmacies can give you these vaccines too. Visit healthinaging.org for more information on these vaccines and other health information for older adults.